Welcome to an introduction to periodontal plastic surgery. My name is Matt Perkins, I'm a specialist in periodontics, and today we're going to talk you through the treatment of mucogingival recession defects. I'd like to start this off by thanking my colleague and friend Edward Samut for some of the slides that you're going to see today. The aims and objectives of today are to discuss the anatomy of gingival soft tissue and the rationale for soft tissue augmentation, to discuss the classification of gingival recession defects, to overview the indications for periodontal plastic surgery procedures, to overview techniques for soft tissue augmentation and their advantages and disadvantages, and to overview techniques for root coverage and their advantages and disadvantages. The definition of mucogingival surgery or periodontal plastic surgery are procedures for the correction of defects in morphology, position and/or amount of soft tissue and underlying bone support at teeth and implants. A little bit of anatomy revision for you first of all. You can see from the diagram here that we have the gingival margin and then we have the free gingiva. This is keratinized tissue that is not attached to the tooth surface, so this is essentially the pocket area. Then we have the free gingival groove and then the attached gingiva, the tough gum that surrounds the teeth. The line between the tough gum and the non-keratinized mucosa is known as the mucogingival junction, and this is crucial, as you'll see later when we talk about classification. And then above the mucogingival junction we have non-keratinized mucosa, which turns the corner and becomes the lips and cheeks. Essentially, here's a cross-sectional diagram illustrating the same anatomy. You can see the attached gingivae, the free gingival groove, that keratinized free gingivae that's not attached to the tooth surface, and then you've got the sulcus or the pocket there, and the junctional epithelium attaching the soft tissues to the tooth surface. Gingival aesthetics are a complex thing and they really are very case dependent. Smile line is a particularly important factor, as in patients with a high smile line, gingival aesthetics really are quite essential to get the smile looking natural and harmonious. We'll also need to look at the gingival biotype and the shape of the teeth, and we'll talk about this a little later. We also need to look at the existing gingival aesthetics. If we have somebody who has pristine gingival aesthetics, it's much more important that we focus on that as part of their overall management of their smile. Some patients have irregularities in the gingival soft tissues anyway, and it may be less crucial in those cases. Patient expectation is also something that's crucial to assess before we start any kind of periodontal plastic surgery. Although we may not consider, for example, the coverage of roots to be particularly important, if a patient has a particular expectation of root coverage, that's something we need to explore and address prior to picking up a scalpel for the first time. It's also important that we preoperatively plan our periodontal plastic procedures to ensure we use the most appropriate technique in the most appropriate way. So if we look at the diagram, we can see here that the gingival zenith is the midpoint, the highest point of the gingival tissue. We then have the tangent, which runs essentially from the upper centrals to the canine region, and you should note that the lateral incisor will be approximately 1 millimeter or so lower than the central incisor and the canine. You'll also notice that papilla should be approximately 50% of the height. And then we also look at the midline of the tooth and the bisected midline here. And the combination of these things give us a natural looking soft tissue profile to a smile. The gingival biotype is something that's really very important that we assess prior to any kind of periodontal surgery, whether it be plastic surgery or